So this video is on Chapter 22, Traumatic Brain Injury. So we'll be going through the signs and symptoms of a TBI. We will talk about the importance of monitoring intracranial pressures and the clinical manifestations of a TBI. So traumatic brain injury, or a TBI, is the result of an external physical force that has the potential to cause mild to complex alterations in brain function. So some examples of this might be a gunshot wound, a motor vehicle accident, or a sports accident. More than 30% of all injury-related deaths are due to a TBI. About 1.7 million people will sustain a TBI each year, resulting in about 52,000 deaths and about 275,000 hospitalizations. Falls are the leading cause of head trauma, and men are 2 times more likely to sustain a TBI than women. The primary injury from a TBI refers to the damage that occurs from the initial injury, such as a fracture. A secondary injury refers to the changes in the brain that occur as a result of the trauma, such as swelling, a change in blood flow, injury to the neural components or the axons within the brain. So this figure is in your book on page 692. This just represents kind of the changes that we're going to see after an initial injury, so the trauma from the event. So the trauma from the event can contribute to hypotension and hypoxia. Through the process of production or free radicals, we see a release of amino acids, which result in secondary injury to the neural system. There is a biochemical and molecular cascade that leads to our secondary neural injury. This is an example of closed head injuries. So we can see with these scans here on the top, we have damage to the left side of the brain. Okay, you can see the arrows are pointing to that here. Again, on the bottom, again another traumatic brain injury, we see damage to the right side of the brain. Feel free to click on this link. It is a very short 1-minute video kind of talking about the effects of a TBI. So TBIs can be classified as mild, moderate, or severe. A mild TBI is often used interchangeably with the term concussion. A moderate or more severe TBI often has very severe, long-lasting impairments. So we're going to discuss the different changes that occur in the brain that are going to affect function. So we're going to see vascular changes. So damage will occur at the time of impact, and this can lead to neuron tissue necrosis. Contusions typically occur at the poles of the brain, so the front or the back, or the inferior surface. An occipital blow, so a blow from the back of the head, will most often result in a contusion to the front part of the brain. We will often see hemorrhagic lesions due to damage to blood vessels. This occurs because of shearing forces. This increase in blood volume or bleeding will result in an increased intracranial pressure. And increased blood pooling can occur in any area of the brain, resulting in increased intracranial pressure and displacement of the brain. We will see parenchymal changes. So this is often going to be axonal injury. This is either going to be localized to the area of trauma, or it can be diffuse around the brain. This is going to be caused by shearing or tensile forces that occur. The distal axon segment we're going to see is going to detach, and we're going to see something called Wallerian degeneration. So this is when the nerve fiber is cut or crushed or damaged, and it separates from the neuron cell body and it degenerates. The myelin sheath will pull away from the axon, and this in the diffuse axonal injury, some intact neurons will remain. We will often see secondary cell death by necrosis, and this will often occur because of increased edema, again, or that increased intracranial pressure. And we're often going to see changes in neurotransmitters that can lead to dysfunction. We will often see compressive damage to the brain stem or parts of the brain. So with increased intracranial pressure, this is going to produce a herniation or a shifting. This shift, again, can compress the brainstem or other structures. In very severe cases, this can lead to death. In less severe changes, we're going to see an autonomic nervous system response, so change in heart rate, blood pressure, respiratory rate, things like that. We'll often see hypoxia, so a decrease or lack of blood flow to the area of injury. This will result in decreased oxygenation of our neural tissue. This is often going to occur from low blood pressure, so hypotension. We can see hypertension, which will lead to increased intracranial pressure. And this will lead to decreased cerebral perfusion. So that's the CPP on the slide that I have here, cerebral perfusion pressure. So cerebral perfusion pressure is a pressure gradient that drives cerebral blood flow. So it will bring oxygen and nutrients to the brain. So we calculate our cerebral perfusion pressure by calculating the mean arterial pressure minus our intracranial pressure. So our mean arterial pressure is calculated as 1/3 of the systolic blood pressure plus 2/3 of the diastolic pressure. So if somebody has a blood pressure of 120/80, our mean arterial pressure will be 1/3 of 120 and 2/3 of 80, so 120/80. So this calculates out to a mean arterial pressure of 93. Then we subtract the intracranial pressure, which normal intracranial pressure values are about 5 to 15 milligrams of mercury, and then this will give us our cerebral perfusion pressure. So normal cerebral perfusion pressure is between 50 and 150. And research has actually shown that cerebral perfusion pressure at about 70 milligrams of mercury, which we said 50 to 150 is normal. So, but if someone with a TBI has a measure of 70, they have a 35% reduction in mortality. So it's really important that this cerebral perfusion pressure is monitored and we make sure that it is not elevated, and this will lead to poorer outcomes. So moving on to our clinical manifestations, as we mentioned, a concussion is often referred to as a mild TBI. There is sometimes no loss of consciousness with a concussion. However, post-concussive syndrome often occurs within 7 to 10 days after the injury, and symptoms are very variable. Symptoms can include nausea, vomiting, dizziness, irritability, memory problems, sensitivity to light, difficulty concentrating, and vision problems. We actually know very little about how to treat concussions. The old mentality was to rest and not be active. However, there's a lot of research coming out that is suggesting that this is not necessarily the best course of treatment. Level of consciousness, we already discussed this in a previous lecture. We would use the Glasgow Coma Scale to measure this. One of the states that can be present with someone with a TBI is something called a persistent vegetative state, and this is characterized by wakefulness, but a reduced responsiveness with no evident cortical function. So that means that someone may have some eye movement, but they're lacking the awareness of themselves and their environment. This is typically from a diffuse injury to the brain and when hypoxia is present, but the brainstem is still usually intact. Something that you'll need to do for part of your homework is to go through the Ranchos Los Amigos scale, and these are the different levels of cognitive function. So there's 8 different levels, okay, and you'll need to know the terms that are used to describe each of these phases. So this is a good need to know for the exam. So make sure you go through your Ranchos Los Amigos scale and you know the 8 levels of function. We can see respiratory impairments with these patients. Breathing is going to be affected if there's some damage to the diencephalon, which remember we said the diencephalon is the epithalamus, the thalamus, and the hypothalamus. We talked about some different types of breathing patterns earlier on in our respiratory section. And lastly, our cognitive behavioral impairments can be seen with these patients. There will be problems with attention, memory, concentration, and executive function. Head and neck pain is very common after a physical trauma. Oftentimes patients will have neuropathic pain as a result to damage to the central or peripheral nervous system and an abnormal sensory processing of this information. We can see cranial nerve damage that can be focal to the brainstem. Our motor deficits would include abnormal movement patterns, so that might be a hemiplegia, abnormal reflexes, changes in muscle tone. We can also see different posturing that we reviewed, decorticate versus decerebrate posturing. We may also see slow movement, bradykinesia. We could see ataxia, dysmetria, and tremors. Heterotopic ossification may also be observed. Again, this is that abnormal bone growth. Again, we're not really sure why this occurs. Some think it could be related to the trauma. However, it can occur long after the initial injury. Other complications that we may see after TBI could be cardiovascular effects, respiratory effects, as well as gastric issues. The last thing to cover with our TBI section is TBIs in children. A TBI is one of the leading causes of death and disability in children for all ages. Non-accidental injury is a common cause for head injury in infants and toddlers and is often the result of battered children syndrome. Our rehabilitation goals for the child or adolescent is similar to those of the adult, although, as we talked about in growth and development, we typically will use play or those types of terminologies during our therapy session.